Over the past 10 years or so, we've been conducting research to look at the health benefits of lupin. Now, lupin is a grain legume which is grown in rotation with cereal crops, mostly in Western Australia. Most of world production occurs in Western Australia. Lupin is used mainly as animal feed, but there is the potential for significant amounts of lupin to be used as human food. Now, lupin has a number of attributes which make it potentially useful as a human food. It's very high in protein, very high in fibre, and it contains a number of nutrients and phytochemicals which may benefit health. Looking at lupin and cardiovascular health, our approach has been to incorporate lupin into a staple food such as bread. So lupin can be used, ground down into flour, and can be used to partially replace wheat flour in bread. And we've done that and used that bread and other foods that we've developed in a similar way to investigate the effects on measures related to cardiometabolic health. We've looked at appetite with the idea that lupin-containing foods might improve or might result in weight loss. And we found significant short-term benefits on appetite, significant reductions within a meal when people consume lupin, and on to the next meal when people consume lupin. However, we've done 2 longer-term trials where we haven't been able to show significant weight reduction when people eat lupin-containing foods regularly over between 4 and 12 months. However, in these trials we have shown significant reductions in blood pressure of the order of between 1 and 3 millimetres mercury, which would be consistent with, at a population level, reductions of about 10% in the risk of hypertension and stroke. And the other main area that we've looked at is glucose and insulin metabolism in relation to potential benefits for people at risk or having type 2 diabetes. And here we've shown significant short-term effects on glucose, postprandial, post-meal glucose responses. And in the longer-term study, over 12 months, we saw significant reductions in measures of insulin sensitivity. Now these were in people without diabetes, so we really need to follow that up in people who do have diabetes. And we've got a study going on at the moment, which will be finished by the end of this year, looking at the effects over 8 weeks of regular consumption of lupin-enriched foods on glycemic management and insulin sensitivity in this population.